Don't look now, but your pocket is being picked. In tonight's Eye on America, we begin an examination of Medicare fraud. It costs taxpayers billions every year. In our first report, we look at one of the alleged offenders, Columbia HCA Healthcare. 3 of its executives will be arraigned tomorrow on fraud charges. And as Wyatt Andrews reports, the federal investigation is just beginning.
Did you defraud the Medicare system? No.
It involves hundreds of FBI agents, truckloads of documents, 40 search warrants served in 6 states. It's the largest Medicare fraud investigation ever, and it targets America's largest hospital chain, Columbia HCA. Congressman Pete Stark of California, a longtime enemy of the company, says Columbia was good, too good at billing Medicare.
I suspect that they made it an art form, that they were specifically training their executives to basically steal from the government. They're the poster children of how to game the system.
Were you surprised by the charges?
I have nothing to say.
So far, 3 Columbia executives face charges they gamed the system by overbilling Medicare in Florida. But according to prosecutors, these indictments are just the beginning. The government is focusing on the creative ways that some Columbia hospitals would bill Medicare and whether those schemes amounted to fraud. For example, in Texas, the government is asking if Columbia gave doctors illegal payoffs in return for patient referrals. In Utah, did Columbia unbundle, that is, perform 1 lab test but charge the government for 2? In Florida, did Columbia overcharge Medicare for home health care? And in several states, did Columbia upcode, that is, treat a patient for a mild disease, then bill Medicare for something more expensive? Someone comes in with, a complicated cold,
yes,
but you get billed for pneumonia.
That's right. That can happen and has.
June Gibbs Brown is the top cop, the Inspector General for the Medicare payment system, and she is probing whether Columbia and others were upcoding Medicare bills systematically.
We understand that mistakes can happen, but when all the coding mistakes favor the person who's getting paid, then we think there's a problem.
The quality, cost-effective health care that you deserve.
As a company, Columbia was a brand new animal, a for-profit mega chain that started with 2 hospitals in Texas in 1986, and in 10 years gobbled up 343 hospitals and 570 home health firms nationwide. Its charming young CEO, Rick Scott, promised explosive growth to shareholders and low-cost quality care to patients. But to insiders, Rick Scott could be ruthless, demanding 15 to 20% annual growth in an industry where 5% was considered good. Larry Kaplan, who ran a Columbia hospital in Boston, says profit pressure may have tempted some managers to raid Medicare.
I can tell you that in Massachusetts, 15 to 20% a year return is far in excess of anything that can be legally achieved.
And your suspicion is that led to what?
That led to administrators approaching the line and at times going over the line in terms of illegal activities.
There certainly was no such order as that.
No such order to
overbill Medicare.
Columbia's senior vice president, David Manning, says the company has promised to cooperate with the government, that Rick Scott and other top managers are out. And without admitting it did anything wrong, Columbia will end its financial ties to doctors, he says, and review its billing of Medicare. Is it fair to say, Mr. Manning, then, that you are cutting loose those practices and areas that seem to be getting you in trouble with the government?
I think it's fair to say that we've taken a hard look at what we're doing in all areas. And if there were anything inappropriate or improper done, proper steps will be taken to address them.
Meanwhile, Medicare, that $200 billion safety net for seniors and the disabled, is barely solvent, and the government admits mistakes and fraud cost this system at least $23 billion every year. The question is, was Columbia exploiting the rules of Medicare legally, or was it so driven by profits it drove itself to break the law? In Nashville, Wyatt Andrews for Eye on America.